introduce my longtime friend, Bill Corr, who has just concluded 6.5 years of service as the Deputy Secretary of the U.S. Department of Health and Human Services. In this role, Bill provided leadership in partnership with 2 HHS secretaries on a spectacular array of issues that affect the lives of every person in our country. He's a deeply principled and highly effective public servant with in-depth knowledge of health reform, public health, community health, the needs of an aging society, women's health, welfare reform, Head Start, drug policy, mental wellness, and the roles of crucial entities that affect all of our lives that he helped to supervise, like the Food and Drug Administration, the National Institutes of Health, the Center for Disease Control and Prevention, the Office of the U.S. Surgeon General. I'd venture to say if you looked at the headlines of the New York Times over the past 15 years, on about 90% of the days, there was a front page story covering an issue that Bill Corr was working on directly. Bill and I were colleagues from 1993 to 1996 under the leadership of then HHS Secretary Donna Shalala. And in those 4 years, I saw in Bill an inspiring commitment to ensuring that government serves the many and not the few. A penetrating political intelligence, giving him the skill along with the will to push for changes that protect everyday people. A fundamental commitment to working across the aisle to get results that empower people. An absolutely unparalleled daily ability to handle and integrate that dizzying array of complex issues that I alluded to, meeting after meeting, just gathering with the nation's leading experts in health and human services on these tough topics, at 10 o'clock, at 11 o'clock, at 12 o'clock, at 1 o'clock, a different topic each hour with some of the best thinkers in the country, working on the hard issues, but with the capacity always to stay calm and move an agenda forward. One of the projects from the 90s that Bill did particularly impactful work on, I actually felt at the time it was going to be a hopeless cause, was the preventable national tragedy of tobacco addiction and the power and prevalence of a tobacco culture that was unbelievably effective in the 90s at getting about 3,000 young people a day hooked on a biochemical dependency that would ultimately steal their looks, their money, and their health. I won't tell you in this introduction the story of Bill's work with then FDA Commissioner David Kessler, Secretary Shalala, and President Clinton to move the issue onto the front of the policy burner. In 1995, when President Clinton had just lost the House of Representatives and seemingly had absolutely no legislative power, and had a handful of Southern Democrats who had won re-election in the House, for whom the tobacco issue was essentially political suicide. And it was in that context that Bill worked with those other leaders to develop a tobacco strategy. And that he had the skill to really roll back some of Big Tobacco's power at that time and to protect kids and families. And he did such a great job that he was tapped in the 2000s to be the president of an amazing organization, the Campaign for Tobacco-Free Kids, about which he may speak today a little bit. Well, in addition to the work that I described at HHS, Bill provided leadership in his years in public service on many other public policy issues, including having served as chief counsel and policy director for Senator Tom Daschle when he was the U.S. Senate Minority Leader from 1998 to 2000. Bill is a signature leader in health policy and public policy. He's been doing it for decades at an incredibly high level. And I would note for the students here that his undergraduate major was in the dismal science and economics at the University of Virginia. He earned a law degree from Vanderbilt. And it shows there are many ways into leadership. There's many fields one can study that working at a high level, as Bill has done, will allow you to keep working at it to bring something very meaningful to national public policy debates. I've never worked with a more dedicated public servant, a more respectful and generous colleague, or a more effective leader. And I would say, in an era when so many have become cynical about public policy and politics, that the presence of individuals like Bill Corr, working for our country at the highest levels, is a reminder that public policy, in fact, does continue to attract individuals of extraordinary integrity and vision. Bill, please come forward. Thank you for being here.
Wow, thank you, Dan. As you said, Dan, that was over the top. We had some wonderful years working together at the Department of Health and Human Services, and of course since then in so many ways. That's a very generous introduction, and I want to thank you again. And I want to tell you a story about Dan. It just happened yesterday. When I arrived, we started talking last night, had dinner together, and I said to him at one point, Dan, how are you doing? And his was his response. We look for the most talented young people across the country, and we have found them, and they are here. And that's our mission, to find these talented young people and give them the opportunities here at Franklin and Marshall. Talented to Dan, though, is not just academics. Talented is personal values, it's integrity, it's building blocks of being a productive and engaged citizen and a future leader. So when you ask Dan how he's doing, his answer is about how Franklin and Marshall and how you are doing. And that's what makes him so special. Not only as a college president, but as a friend and as a just dedicated citizen. His dedication is to Franklin and Marshall, enabling you to have an impact with your life. So Dan, congratulations to you, and thank you for inviting me to come. But thank you mostly for all that you've done here at Franklin and Marshall. So would you all join me, because I'd like to congratulate you. Given the subject today about tobacco, I also want to congratulate Franklin and Marshall on having a public health undergraduate major. You are very, very unusual in doing this, and you are a trailblazer at a critical time in our nation's development and in our nation's health. The high costs of healthcare are rising. 80% of our healthcare costs are spent on chronic diseases. We have an aging population. The challenges to our public health are enormous, and your interdisciplinary approach to public health major reflects the reality of the public health challenges that our nation faces. In this morning's paper, you look across the different papers, what you'll find is the president of West Virginia talking about prescription drug abuse. We've got a commissioner of public health in Baltimore talking about mental health in prisons. We have so many issues require a public health perspective, and Franklin and Marshall is once again providing leadership to our country. The title of the Common Hour, as you've seen and maybe had a chance to read, I want to, at the beginning here, amend the title to say this, because this is what I really want to talk about. We can save 1 billion lives. We know how to save 1 billion lives by reducing tobacco use. The question is, will we? Will we do the things that are necessary? We know we can reduce tobacco use because in the last 20 years, we have made tremendous progress in the United States and more recently around the world. And we have learned which actions reduce tobacco use and which don't. We've also learned that our efforts must be sustained for many, many years, and our elected officials must continue to have the political will to implement tobacco control policies. Will we sustain our efforts and our focus is the question that needs to be put to our nation's leaders, be they elected or appointed, public or private. If we care about the health of the American people, and especially our children, and if we care about the health of citizens of the world, we have to answer this question. So what makes tobacco control so hard that it requires years and years of sustained effort? The tobacco industry in the United States and around the world is very powerful. They have three major advantages that they exercise. First, tobacco companies are very wealthy. And even though their product is addictive and kills half of its users, their business culture is very aggressive. They pressure and influence elected officials, and they use litigation and every legal process to counter, to stop, to delay tobacco control efforts. The tobacco products that you see every day, and especially cigarettes, have been intentionally engineered to be addictive. Cigarettes are engineered down to the size of the smoke particle so that smoke is drawn deeper into the lungs, allowing the nicotine to be absorbed and sent to the brain faster. The tobacco companies had a choice 40 years ago, 50 years ago, to produce larger smoke particles that would stop in the mouth. They chose smaller smoke particles, which created an entirely different set of health issues that involved the lungs. All because they wanted to assure addiction. New users of tobacco products are children 10 to 18 years old. This is the most important thing I'm going to tell you today as we think about what we need to do. Children 10 to 18 are too young to weigh the lifetime burden of addiction and to make a choice. They think they can stop whenever they want to, but in large numbers, they become adult lifetime tobacco users. 90% of adults who smoke started when they were 18 or younger. Somewhere around 10 to 12 is when you get your first kids trying tobacco. Public health and tobacco control advocates are engaged in an intense struggle to defeat the tobacco industry's power and influence and to save lives. But these industry advantages that we just talked about mean that we cannot turn our full attention away from this job. We cannot lessen our efforts until the tobacco epidemic is over. So I want to take a few minutes and go back in time. And I want to demonstrate to you the progress that we've made. And I want to describe what we've learned and what we're doing to end the tobacco epidemic in the United States. And then I want to share with you the tobacco control activity and successes and challenges that are occurring around the world. First, let's start with the good news. The charts go this way. We have made substantial progress in cutting both adult and youth tobacco use. Let's start with adults at the top of the chart. 1965, the height of adult smoking, 42.4% of adults smoked. 48 years later, we're down to 17.8. You might say, 48 years to get there? The fact is, and I'm going to tell you more about this later, our real progress didn't begin until 1994, and I'll tell you why. 17.8% may sound, well, that's pretty good. 82% of adults don't smoke. It's 42 million people who continue to smoke and are addicted. Even with this progress, tobacco remains today the leading cause of preventable death, with 480,000 people dying every year from tobacco-related illness. Let's look at the high school numbers. We've gone from a peak in 1997. The companies between 65 and 97 were targeting kids. And in 1997, we reached the peak of 36.4%. We now know from internal tobacco industry documents that have been exposed because of litigation that they knew that adults don't start smoking. They've known it for a long time. Remember, 90% of adults started smoking when they were 18 or younger. And long before the public health community figured that out, the tobacco industry understood it. So 15.7% is good progress. In just 16 years, down to 15.7 is good progress in just 16 years. You may say, just 16 years? It takes that long to effectuate these major public policies. But at 15.7%, our Surgeon General in January of this year issued a new report, and he kept us on track because he told us that if the trends today continue, if we do not make more progress, 5.6 million children alive today will die prematurely from tobacco use. We have so much still at stake. So we've made good progress, but we've got a huge toll on health that continues. And as we push the youth smoking rates down, it gets harder and harder to reach and influence the at-risk kids that we need to reach. I said to you earlier that our progress to these current numbers accelerated starting in 1994. So here's what happened in the last 20 years, and here's what we've learned that we're using today. First, the tobacco industry's political strength was disrupted and diminished at the national, state, and local levels, and the respective governments took steps to address the toll of tobacco, and as part of the reason we've seen these rates decline. Industry power began to wane in 1994 when the CEOs of 7 tobacco companies stood before the United States Congress in sworn testimony and said that they did not believe that cigarettes were addictive. 1994, 30 years after the first Surgeon General report in 1964 that tobacco caused illness and death. Also in 1994, the Commissioner of the Food and Drug Administration, Dan alluded to this in his comments, testified before the Congress that tobacco companies intentionally manipulate tobacco content to increase addictiveness. We just learned that ourselves in the early 90s. Also in 1994, it became clear that tobacco addiction was a pediatric disease because, as I've said, 90% of initiation is when kids are young. In 1998, 40 state attorneys generals sued the tobacco companies for causing the states to pay for Medicaid costs of illnesses caused by tobacco use. The companies settled for $206 billion over 25 years. Don't worry about it. $206 billion hasn't affected them in the least. They are so wealthy. In 1999, the Department of Justice, U.S. Department of Justice, under President Clinton, sued the tobacco companies for fraud under the Racketeer Influenced and Corrupt Organizations Act, and they were found guilty in 2006. And in 2009, in overwhelming votes in the Congress authorized the FDA to regulate all tobacco products and their marketing. And Congress required tobacco companies to pay user fees to the FDA so that its regulatory work is fully funded every year in perpetuity. Also in the last 20 years, public attitudes have changed significantly in support of tobacco regulation. Voters wanted to protect kids from starting to smoke, and they wanted to protect non-smokers from secondhand smoke. State and legislative bodies have followed the public, and because of very active, and have been very active in passing laws and regulations that during this time we thought were the most effective way to proceed. States and cities passed new tobacco excise taxes that raised the price of tobacco. It has turned out to be one of our most effective. I know this is hard for you to see, but let me just give you, these are current tobacco excise taxes. So the average price of a pack across the whole country is about $6.50. In places like New York, it's over $10. But in New York, the excise tax is $4.35. Montana, $1.70. Texas, $1.41. Georgia, a tobacco state, 37 cents. Virginia, a tobacco state, 30 cents, used to be 3. This is where political advocacy comes to play. States that wanted to do something about reducing tobacco rates among kids have been raising their excise taxes. and it's made a huge difference. States have increased their retailer compliance programs to stop the unlawful sales to minors. States have created and funded statewide tobacco prevention and cessation programs during these last 20 years. States and cities have passed bans on smoking in workplaces, including restaurants and bars. This slide will show you the yellow are the states where you have statewide law. And the other states you can see where cities or counties have passed smoke-free ordinances. Over 80% of Americans are protected by smoke-free workplace laws. We still have a few more states to go. Public health advocacy efforts have been greatly expanded in the last 20 years. The American Heart Association, the American Cancer Society, American Lung Association, the Campaign for Tobacco-Free Kids, the American Legacy Foundation, Bloomberg Philanthropies, former mayor of New York City, Robert Wood Johnson Foundation, many health organizations have put resources into this effort to change the way we deal with tobacco in this country. Research was done during these last 20 years, and substantial data was collected. It has been crucial in knowing what works and what doesn't. And also science around the nicotine addiction has been advanced by the National Cancer Institute and the Food and Drug Administration. The Institute of Medicine and the Surgeon General issued reports confirming that the actions being taken were causing the decline in tobacco use and exposure to secondhand smoke. Insurance companies' coverage of cessation was expanded. So in many fronts, much was going on. And as these numbers came down in use, it simply encouraged greater action. So now, at the end of this 20-year period, we can draw three very important conclusions. First, we have broad consensus and evidence captured by the Surgeon General, the Institute of Medicine, and the National Cancer Institute that certain strategies reduce tobacco use and its harms. Let me tell you what they are. And it's what we've been working on the last 20 years. First, raising the price of tobacco products through excise taxes has a direct impact on use, and especially on use by kids. For every 10% increase in the real price, there's a 6 to 7% reduction in the number of children who smoke. That's why those excise taxes that you saw are so important. And when there's leadership in a state like New York, you see those excise taxes going very high. The public strongly supports tobacco excise taxes by margins of over 70%. Tobacco excise taxes, in fact, are the one tax that the public doesn't think of as a tax. Smoke-free workplace laws, including restaurants and bars, protect non-smokers from tobacco-caused harm, and it changes the culture of acceptability for tobacco use by children. Statewide prevention and cessation programs reduce the number of children and adults who use tobacco. And most importantly, mass media campaigns targeted on kids reduce the number of kids who smoke. And part of those user fees that the industry is paying to the Food and Drug Administration are funding mass media campaigns by the FDA where they expect to reach over 4 million at-risk youth, multicultural youth, with their second major wave of advertising. And for the seniors in the room like myself, you won't ever see these ads because you're not looking where the kids are looking. And that's what FDA has done so well. At the same time, mass media cessation campaigns, we now know increase the number of adults who try and succeed in quitting tobacco use. And last, we've learned very important lessons about regulation of tobacco products, particularly marketing that influences children and that includes claims of less harm. You remember there used to be a period of time where light and low tar cigarettes were sold and used by many people thinking it improved their health or at least reduced their risk. The Surgeon General and the Institute of Medicine have been very clear in their recommendations that to have maximum effect, we should implement all of these strategies simultaneously and continuously until the rates are down to zero. The second conclusion of this period is that it is critical to regulate the tobacco product itself, not just its market. And it's critical to regulate all tobacco products, including every new one and their contents. FDA, because of the 2009 law that the Congress supported, has the authority now to require harmful ingredients to be removed to protect addicted adults who don't or can't stop using tobacco products. FDA can focus on nicotine levels and addiction. FDA can prohibit all claims or claims of less harm that imply less harm, like light and low tar. And they can regulate all new products. And this is the most important thing. New products have to meet a public health standard of appropriateness for the protection of public health, which means it has to help reduce use, reduce addiction, reduce harm. And it has to be proven with evidence by the proponent of the new product. These new authorities require FDA to act by regulation. It is a long process to develop a regulation through a notice and comment rulemaking where you put it out, a proposed reg out, you get public comment. The industry submits millions of pages of comments, causing FDA to have to review all of them before they can establish a final rule. But the Food and Drug Administration is moving under this new authority in all of these areas. And it's very important that we deal with new products. How many of you have seen or heard about e-cigarettes, electronic cigarettes? Many of you know, CDC told us just recently that in this last year, there was a 30% increase in the number of middle and high school children who have used an e-cigarette in the last 30 days. It doesn't have the dangers of burning tobacco and inhaling burned tobacco, but it's nicotine, which is addictive, affects the brain at an early age, and it's got propellants and other ingredients, and we don't know what's in it, and there's no regulation of it. And that's what FDA's job will be, is to determine how to proceed. Those was what I was just speaking about, was regulating the product. The third important conclusion is that we've got to do a better job in helping addicted adults stop using tobacco. The 2010 Affordable Care Act expands coverage for tobacco cessation by private insurance, by Medicare, and by Medicaid. And our goal, of course, is to give better tools to adults who want to quit. So now, we have proven strategies. At the end of this 20-year period, we have new authorities. So what does the future hold? This is the concern that I have. Our public and our elected officials lose attention as problems subside or are perceived to subside. We lose our sense of urgency. We lose our sense of demand that we've got to address a problem. 82% of adults don't smoke. Most kids don't smoke. For an adult like me, I rarely see anyone using tobacco products. It doesn't mean the problem is solved. I've told you about the consequences. 480,000 lives a year, 5.6 million kids at risk for their lives. Litigation, and the tobacco industry litigates everything. Every step the government takes, every step the Food and Drug Administration takes will be litigated, and it slows the process down. To a company that's got addicted customers, one more year is just one more year of profit, so stretch everything out that has an effect on you. Continuity is absolutely critical. Every year, there's a new group of kids that turn 10 and 11 and 12. You can never stop because you have a new cohort of kids who haven't heard your messages, who haven't been affected by what we know. Addiction is very hard to break for many, many adults. So we still have these major challenges ahead of us. I want to take just a minute, pause, and turn to the international picture, and then come back and wrap all this up for you. As I said, the toll in the U.S. is high, 480,000 premature deaths from tobacco-related illnesses. Worldwide, the picture is much worse, especially in low and middle-income countries where the tobacco industry can easily avoid and overwhelm countries that are trying to enforce new laws. The current projection by the World Health Organization is that by 2030, there will be 8 million people who die prematurely around the world every year from tobacco. And 80% of those people will be in low to middle income countries. The current trends mean that 250 million children and young people alive today will die from tobacco-related illnesses around the world. And the current trends are, and that's the common hour title, 1 billion lives will be lost to tobacco-related illnesses in the next century if we don't change our trajectory. While we in the U.S. have focused on using strategies that are proven to work, so have public health authorities around the world. We're learning from each other, we're working closely together, we're studying the effectiveness of different tobacco control measures, always doing research, always collecting data, so we can prove to elected officials what steps they need to take. And as in the United States, some of these strategies worldwide have been incorporated into new international law. In 2005, the world's first public health treaty was finished and signed. It is the World Health Organization's Framework Convention on Tobacco Control. It calls on nations to implement scientifically proven measures to reduce tobacco use and exposure to secondhand smoke. And I won't read you the list of them because it's what we're doing here. It's all the things I've told you we've learned over the last 20 years. Has all been captured in an international treaty signed by 180 countries. The U.S. signed it but has not ratified it. But everything in it that it calls for is being done in the United States today. Other developed countries are pursuing even stronger tobacco control policies than we in the United States are. Australia requires all cigarette packaging to be plain brown paper with just the name of the company on it. No colors, no imagery, and they also require graphic warning labels to be slapped onto the back of the plain brown packaging. Ireland became the first nation to go smoke-free. The U.S. has recently taken a very, very important step in international tobacco control. You may have heard about a recent trade agreement, the Trans-Pacific Partnership, that the Obama administration has just concluded, working with 12 Pacific Rim countries that make up 40% of the world's economy. And in the Trans-Pacific Partnership Trade Agreement, there is a provision that prohibits tobacco companies from using the trade laws and from using trade tribunals to challenge a country's tobacco control regulation. It goes like this. Australia passes a law in its legislature that all packaging has to be plain brown. The tobacco industry goes into a trade tribunal, an international trade tribunal, and says, pursuant to treaties, Australia cannot take steps that reduces our investment in their country. Just the threat of these lawsuits have prevented many countries from going forward with tobacco regulation. The Trans-Pacific Partnership Trade Agreement, if passed by the Congress, will stop the tobacco companies. This really doesn't affect the United States. What it does is it affects all these countries around the world that are trying to do stronger tobacco control regulation. Let me show you with some quick slides the progress we've made around the world. And as Dan mentioned, I used to work at the Campaign for Tobacco-Free Kids, so I pilfered a few of their slides. In 2006, smoking was rising in virtually every low and middle income country, offsetting the declines in countries like ours. But today, excluding China and Indonesia, that's a big exclusion, smoking is heading down across the globe in every continent. You can see these numbers. In 2013, down 15% in the Philippines, more than 7% in Russia, Ukraine, Turkey, Brazil. We're even seeing some change now in China. Here's what's happened with smoke-free workplace laws, which we know about here in the United States. In 1994, California was the first state to pass a smoke-free law. In 2004, Ireland went smoke-free as a country. Since then, 40 countries and many other jurisdictions have gone smoke-free. And Beijing, in June, became smoke-free. As of May 2015, 44 countries have enacted 100% indoor smoke-free policies. The U.S. isn't included there because not every state and every city is covered by smoke-free, but you can see the use around the world of indoor smoke-free policies. As of May 2015, 85 countries and jurisdictions require graphic warnings, pictorial warnings. Have you seen some of these pictures? They're the grossest things you'll ever look at. And that's the point, is that's what can happen with tobacco use. These tobacco packaging requirements require covering 30% of the package with a graphic warning. The U.S. is red, but our regulation hasn't gone into effect because of the tobacco industry laws. As of May 2015, 30 countries have passed complete tobacco advertising, promotion, and sponsorship bans. We have a First Amendment that prevents us from banning all advertising by tobacco industry, but we can ban and regulate tobacco advertising that appeals to kids. You cannot market a lawful product to someone under 18. This is way too much to try to read from where you are. I put this up because these are the countries with the greatest percent of adults smoking. And these are the different tobacco control measures that they've passed and are implementing. And it's the range of things I've been talking about, because just like in the United States, around the world, we're all learning what it is that makes a difference in tobacco use. Those are larger countries. Here's a list of smaller countries. And in the last 5 years, comprehensive national legislation. You have to implement these laws. Just passing them isn't the answer. But the fact that we've taken this many new laws are in effect around the world makes a huge difference. Two good examples. In the Ukraine, with all the problems they've got, here's what's happened with tobacco use. 4 tobacco tax increases since 2008, warning labels since 2012, tobacco advertising, promotion, and sponsorship laws passed since 2012. Smoke-free air law passed in 2012. Sound familiar? We're doing the same thing all over the world. We have to do it though. Ukraine is making good progress. And here's Brazil. The blue line is male smoking, adult smoking. The red line is a female adult smoking. This takes you from 1989 to 2010. The point, I just wanted you to see the slope. And on the right, what's Brazil done over the last 20 years? Tax increases. They started out with local smoke-free workplace laws. Now they've got a national. Banning point of sale advertising, pictorial warning, health warnings. All of these things are being used around the world. So, we have made tremendous strides in the U.S., and we have to acknowledge that. We have to be proud of it, and we have to remember how much progress we've made. And around the world, we're making important progress. And we are reducing tobacco use and the disease and death that it causes. But, notwithstanding 20 years of hard work, we are truly at the beginning of our life-saving efforts. Our public at large, and the public in other countries, and our respective governments, as I said earlier, We do not stay focused on societal problems as they appear to be subsiding. And our fear in the tobacco control advocacy movement is that too many people think we've made great progress and we can turn our attention elsewhere. That's why our Surgeon General reminded us in the last Surgeon General's report, as I said earlier, if we fail to make further progress, if we allow current trends to exist, 5.6 million U.S. children alive today will die prematurely. And around the world, 1 billion lives will be lost in the next century. In the U.S. and in all other countries, we can overcome the power of the tobacco industry. We can overcome the powerful addictiveness of tobacco. We can overcome the vulnerability of youth to initiation. We can use all of our regulatory tools and prevention strategies. And we can remain focused and determined to end the tobacco epidemic. And that's where I want to end with you, by saying, as a passionate public health advocate, let us hold our country, let us hold our states and our communities and all of our leaders, public and private, accountable for sustaining our most aggressive efforts until the day comes that we can say we have ended the tobacco epidemic for all time. Thank you.
Hi, my name is Ailey. I'm a junior here at Franklin and Marshall. I grew up in Denver, Colorado, and I remember growing up and seeing the decreased use of tobacco products, and it was awesome because that was never something my family promoted. However, I also noticed through my growing up the increase in use of other drugs due to the restraint of the ability to get tobacco products. So like where I grew up, it was marijuana. In Colorado Springs, it was cocaine. So are there being studies done and efforts made to reduce those along with tobacco? Because I thoroughly encourage the continued reduction of tobacco products, but we have to work towards other things too.
Absolutely, and this is one of the greatest challenges of government and of public health, is that you can't just focus on one thing. Dan alluded to this. There are so many issues that demand our attention constantly. These are different. The reason I wanted you all to see about what the tobacco industry has done and how they've made the product addictive and who they've targeted is you have to understand why you're having the problem. And that's where you've got to go with your solutions. And the solutions in tobacco control are different than in prescription drug abuse. The president just was in West Virginia yesterday speaking about prescription drug abuse. It is the new epidemic across our country. We've got increases in drug use. So that each of these problems, we cannot say, well, we're going to focus on tobacco. We've got to do it all, and we can do it all. It just takes leadership, and it takes commitment, and it takes new young people who care about public health, getting into these public health issues and helping us solve them. And so many of these issues, you don't ever really end them for all time. There's a chance with something that's addictive, but if people turn to marijuana or other drugs that are addictive, you've got a similar but different problem that you've got to address. So the answer is we got to do it all.
Thank you.
Of course.
It's Grace, and I'm a public health major here. I'm wondering, what can college campuses do to discourage smoking and move towards smoke-free or
I'm
tobacco?
sorry, would you start that over?
Sorry?
Start over.
What can college campuses do to discourage smoking and move towards smoke-free and tobacco-free policies, and how can we overcome the challenges of doing so?
There has clearly been a movement by the tobacco industry. I don't know, I was asking a few people whether it's really happened here in Lancaster and around F&M. But when we've made such progress with kids and they stopped their marketing to kids, the industry has shifted its marketing focus to 18 to 25-year-olds. They can lawfully purchase tobacco products. And so we can't prohibit companies from communicating with 18 to 25-year-olds unless it's, it's not accurate information. Or, the tools that we have would be influencing people through smoke-free air policies, making sure people understand, the addictiveness of tobacco products. I think you basically have to take the message to young people. By the time you all have gotten to college, you're going to be able to lawfully purchase. So if people are regular smokers, getting them assistance in stopping. It becomes a different issue when young people become of age, but the education about what the harms of tobacco are. And you would think people would understand that, but you got to take the issue to them. And then in any way that the college can be supportive of that, I think is important. And with time, it will make a difference. It's a cultural thing we're going through, and we've got to make it so that kids 12 to 18, it's not cool to smoke, not cool to use e-cigarettes. We're going to get there someday.
I'm Clark McSparron, class of 1955. I'm a pediatrician and school physician in 2 downtown inner city schools here in Lancaster, where 90% of my kids are in poverty. 30% are in smoke-filled homes. 20% are asthmatic. What tools might the federal government provide me on my one-on-one exposure to these kids in 15 minutes to make a difference in their smoking and in their use of smoking?
Well, I think the national strategy really relies upon state and local governments to recognize what it is that we've got to do to help those families, to help the adults if they're smokers in the family, provide cessation treatment, to take the educational efforts to those children. I don't know that I'm trying to think if there are any sort of direct grant programs. There were some major prevention dollars that came out of the Affordable Care Act that were distributed to state health departments. I think the resources, to reach individuals need to come from state and local departments. And that's where, when I talk about leadership top to bottom, we've got to have unified approach and leadership at every level of government and in the private sector. Because those kids are going to wind up addicted and adult smokers, and it will not only be an economic impact on them, but a physical one as well. But in fact, one thing, reach out to the Centers for Disease Control. There may be things that they can do, certainly in terms of materials that could be used. Understanding the other areas that have had similar issues. They can maybe help you with just advice about where you might look for some help.
I'm Larry Bonchek. I think most people in this room know my name, but may not know that I'm a thoracic surgeon. So while you brilliantly address the public health aspects of the problem, I deal with it one-on-one. And in talking to patients after heart or lung surgery and trying to persuade them to stop smoking, I find, first of all, that they are remarkably ignorant of the effects of nicotine. If I tell a coronary bypass patient that nicotine directly damages the lining of blood vessels and causes their problem, that's news to them. They've only been worrying about lung cancer. So first of all, I think we need to do a much better job of very specifically informing the public about the health consequences. It's not enough, in my experience, to just say smoking causes heart disease. That's much too abstract. People don't absorb the message. If I tell people, if you resume smoking, you might as well have never had the bypass. That makes an impression. And the second thing is that women in particular, I appeal to their vanity. They don't understand the effect of nicotine on collagen. And they'll put on a night cream every night that really does nothing, but is promoted as restoring collagen in their skin. Nicotine turns them, of course, into wrinkled old ladies. And when I make that very clear, I think that's a much more powerful message, at least for women. So I think that education of the public still has a role to play, in addition, of course, to all the public health measures that you mentioned.
Thank you very much for those comments. You know that with adults who are addicted smokers or regular smokers, you got one challenge of education. Part of this is a public health strategy. Those of you that are public health majors, move yourself back in time. When you learn that almost all adults started as kids, what does that tell you, right? You got to take this to the kids. Now that's a different educational challenge, is getting the kids not to experiment and to start. So we have two major educational challenges that we've got to continue working on.
My name is Clarissa Grunwald. I'm a junior, and I'm wondering what's being done to reduce the effects of secondhand smoke, especially in terms of kids who grow up with parents who smoke. Are there any policies in place specifically for that issue, or is that something that's covered by more broad policies?
Well, in someone's home, we don't have any regulation. All we have is the power of persuasion. And you might even say this is the third level of education, that adults who smoke need to understand the consequences for other non-smoking members of their family. And a lot of this is education. When you get down to the individuals, it's a lot of education. And it requires all of us, as I've tried to say here. The federal government can't do this by itself. State government, local government, requires private nonprofits. American Cancer, Lung, and Heart Associations, they're all working on this. But it's tough to get the message out. And if we lose our focus, if we think we've made a lot of progress and we turn our attention to something else, the problems will just increase again.
Hi, I'm Susan Manasian. I'm the college chaplain. So I'm 57 years old, and I grew up at the time when we had these massive school assemblies where somebody would come and show us a lung of somebody who has smoked and a lung of somebody who hasn't smoked. And I would go home and cry to my family, please stop smoking because your lungs are going to get all dark and you're going to get cancer and all that. Fast forward to college, I picked up cigarettes and I smoked for 10 years, a pack a day, and put it out after I wrote my last word on my ordination paper. Now, I had decided I would never be one of those recovering smoking people that drives everybody crazy. The question that I have is, I mean, we've talked about the health issues, but the other piece is something I need to ask you about, and that is what I'm hearing from people about being a smoker and having that affect their employment. I'm hearing more and more people say that they are scared about, they don't stand outside of the building anymore to smoke because they're afraid that that will be a part of their review and that they might lose their jobs because they're considered a health risk, and what that means with health insurance and those kinds of things. Is that something that is happening? Are people losing their jobs because they smoke or not?
Well, from an employer perspective, what's happening is the employer says, I'm providing health insurance to my employees and their families. Smokers cost us a lot more money. They're absent more frequently. They're sick more often. What should employers be able to do? Incentives? Penalties? This is a discussion that's going on across the country right now. The Affordable Care Act tries to make sure that we don't wind up causing people to lose health insurance. We need those people in health insurance, but we need them to change behavior. But this is a current topic of debate about the latitude that employers should have to punish Many will offer major financial incentives. Some are offering penalties. And this is going to play itself out. But if you think about it, to really solve this issue, you want to think about it from the employer perspective. Now, employers have to understand, for many, many people, this is a powerful addiction. So what I as an advocate have always said is, as we raise the excise taxes, low-income people that are addicted are paying a lot more money every time they buy a pack of cigarettes. And if they're addicted and can't stop, what is their choice? Well, the answer is, some of that excise tax money needs to go into cessation treatment programs. We need to help the people who are addicted stop. And so we need to work with employers to help them understand the most effective way to get behavioral change. Firing them maybe make the situation worse.
Oh, I think so.
Certainly for the individual. So this is a very important issue you raise.
Thank you.
Hello, my name is Trex O'Hearn, and I'm a sophomore here. I have a question that goes off of what Mr. Blanchek mentioned about specific health consequences, specifically with the newer alternative products that are coming out, such as the vaporizers and e-cigarettes. What damages do those pose to the body? Because my understanding is it's an oil that you're inhaling into your lungs, and I haven't seen a lot of information about the dangers of that, and I feel like you should be an educated user if you're going to use a substance like that.
Well, this is a criticism that I include myself in because it's taken us, the Food and Drug Administration, too long to deal with this issue of new products, and particularly e-cigarettes. The important thing to understand about e-cigarettes is you're not burning, you're not inhaling combusted tobacco products. You're not inhaling the hundreds of ingredients in tobacco products that we know cause cancer and other illnesses. But what are you inhaling? The FDA has the authority to regulate e-cigarettes. As I told you, they're working on that, and they've already put out a proposed rule to deem e-cigarettes to be tobacco products and subject to their regulation. So once FDA has regulatory authority over e-cigarettes, they will have to demonstrate what's in them, and we'll learn enough. Now, nicotine doesn't cause the problems that burned tobacco does, but it affects the body in many ways, and particularly for young people, for kids, it's a significant effect. So they're not without problem, but many people say, and this is the challenge we got, is that those of you that are public health majors, the challenge is if someone would switch to e-cigarettes and are not inhaling combusted tobacco, the assumption is that has to be better for them. But what else are they inhaling? So with regulatory authority over e-cigarettes, we will eventually learn all of that and begin to make some progress.
If I might just add to that answer, it is true that the peak nicotine level is lower with an e-cigarette, but the important point is that the effect of cigarettes on health takes 20 or 30 years to play out. So it's going to take a very long time for us to really know the total picture of the consequences of changing from burning a tobacco leaf to using an e-cigarette. It's going to be decades before we have the full picture.
But excuse me, say one thing that's happened with these cigarettes is they're all being flavored. Who likes flavors? Kids do. So these cigarette companies have got a burden to carry here.
And on a similar point with states such as Colorado and Washington, is the FDA, although marijuana is illegal, are they taking steps now before it becomes a more national thing to regulate and have an understanding of the full effects of marijuana and both the smoking and vaporizing forms of that substance as well?
I tell you, this is a good issue for all of you government majors. Those are state laws. They contradict the Controlled Substances Act, which is a federal law. It's a real dilemma for the federal government as to what to do. So this is all going to play out. To the extent that it increases marijuana use, there will be harms associated with that. I think we have some knowledge about the harms of marijuana, but one of the reasons that medical marijuana is so hard to address from a regulatory standpoint is there's no manufacturing standards. You can't know, as you're the FDA, you can't know that every marijuana cigarette has exactly the same ingredients in it and the same content. So it's a real regulatory challenge, and we're nowhere near getting to the end of it.
I'm Rachel, and I'm a senior. Last year, CVS banned tobacco sales, and I know it's hurt their sales in general, but do you think if other pharmacy companies did the same exact thing would really bring about change on this global level?
Well, those of us in the tobacco control movement certainly hope that CVS's leadership is going to make a difference to all the other pharmacies. CVS recently announced their profit margins and their revenue, and while they have lost revenue from tobacco sales, overall the company is doing well. So the hope is that it is, with increasing time, that other venues that are health-oriented will stop selling all tobacco products. It's a very important cultural message to send, as well as of access.
And now it's going to have to be our last question, so I wanted to ask everyone to join me in thanking Mr. Corr for